we can see you better. Is that better? Yes, I think so. Okay, so can you look at the camera? Look at the camera. That's as good as it's going to get. Good boy. Okay, can we say hello to our guest and our viewers now, please? You say hello. We're very focused on treats this morning, apparently.
Not long after breakfast time. I feel you, Teddy.
Right, okay. So, all right. Look at the camera. Have you got something to say this morning? Is there something that you want to say? Can you speak? You sit up? You sit up. Can you speak? Okay, that was good. So I think that is Teddy's hello to Pet Talk. And with me, Anna Isabel and Teddy. And of course, our wonderful guest today, Amber Batson, whose articles are very precious to me, and I share them widely. And she is a vet. So we thought...
I am, apparently.
Yes. And so welcome to Pet Talk, Amber.
Thank you for inviting me, Anna.
And I guess what we agreed on, because Amber, the list of possibilities that you gave me for things that could be discussed was so exciting. And I wanted to do all of them. But I thought that perhaps to begin with, it would be good if we could just talk about getting our pets comfortable with vet visits. And I think most viewers have dogs and cats. So why don't we talk about those two first of all?
Yeah, absolutely. It's a huge thing, isn't it? And, you know, we're all going to have to take our pet to the vets at some point, no doubt. And we'll chat about some of the alternative options as well, because they are emerging actually, but there is no doubt at some point the majority of us are going to be taking a dog or a cat to the vets. And you know, we know in sort of welfare science, animal behavior science, vet science, that it's a very stressful process for the dog and the cat, arguably perhaps a little bit, maybe even more so for the cat than the dog. But even with dogs, it's recognized that as many as 50 to 75% of dogs are already stressed as they come into the waiting area, and at least 75 to 90% of dogs get stressed during the examination process. So it's a huge topic, and of course that's horrible for us as owners. We don't want our pets to be stressed. You know, and we don't want that to impact on our relationship. We want it to be as pleasant as it can for them. We want to be able to help the vet, you know, to be able to help us with our pet more. And you know, there are all these elements of how it impacts on us as the human, you know, as well. It's been in some questionnaire studies, it's been suggested as one of the main reasons that people don't take a cat or a dog to the vets is because they are worried about how distressed their dog or cat gets at the vets, even though they know that their dog or cat might be sick or is injured. People don't want to go because it just seems too stressy for them. And that's awful, isn't it? You know, that we don't want to, because we want to provide that medical care, but we don't want to cause additional stress. And that's why it's such an important topic.
It is. And I'm just thinking about, I've had 3 cats at different points in my life. And now, of course, I have Teddy. And, you know, with the cats particularly, there's the additional stress of getting them there. That's before they've got them there, because they hated traveling in the car. And I can remember with Cleo, our first cat, the vet practice was not so far that we couldn't walk, but it was far enough that it would be easier to drive them. And yet I remember carrying her there in the carrier, because the car journey was so horrendous for her that we decided we would walk to the vet. So that was Cleo, and our third one, Honey, who was a very frail old lady. When she arrived to be with us, we couldn't even contemplate getting her to a vet. And in fact, we were very, very fortunate that in her last days, we managed to get the vet to come and put her to sleep here at home. I'll always be eternally grateful to that wonderful vet, because it would have been horrendous to get her to a vet. So cats, you're right. It's very tricky. And I can remember our first one, Cleo, having blood tests, and her whole body, you know, as the blood was being taken from her, was shaking. So it's very, very difficult. So what do you suggest we could do to improve things for them?
I think that's the thing, isn't it? I mean, you know, there are two elements to this. There is owner, or kind of, you know, the human companion kind of element of what we can do. And then there's also clearly education for vets about what vets can do to make it better. We're focused today on the human companion, you know, being able to help. But so what I am going to say is, because we're not going to talk specifically about what vets can do, that doesn't stop us as the human companion to our cat or dog chatting to the practice, going without the pet at some point. Now, I know that COVID-19 pandemics made that harder, you know, but getting to know the local practices and the local options is really helpful. You know, making sure that we haven't, you know, that you know that they are thinking about stress less, stress reduction, fear-free handling techniques. What options do they offer? You know, do they have a separate dog and cat waiting area as we go back into kind of, you know, people being able to attend the actual practice? You know, those sorts of things are definitely worth us as the human companion to our cat and dog being, you know, having investigated, you know, and that's all, you know, that I can talk really about in terms of the vet's handling. But, you know, we still have a choice, and we have a voice, and we can advocate for our animals. And if we're not okay with something, then I think it's absolutely fine that we say that, of course, in a respectful way, you know. So what could we do? Let's start off with the cat carrier thing, I think, because that's a really big thing. I think one of the first things, we've got some research that has been done, and I've done it personally myself. We mustn't forget that cats are trainable. They can have learning experiences, and it is totally possible to teach a cat to go into a cat carrier all by itself. And that actually is probably one of the most valuable things that you can do to set yourself up onto the vet journey. Because us having to pick the cat up and force them into a box is the very first start of upping up their stress chemistry, filling them with adrenaline and cortisol and these, you know, unpleasant stress chemicals, which will stay in their body, their bloodstream and their brains, you know, potentially for a number of hours. Now, actually, acute stress chemicals come and go kind of much quicker than that. But if the brain perceives, oh, that was an acute stress, oh, that's an acute stress, oh, that's an acute stress, they will keep being released, you know. So what we don't want to do is if we can get them to the vets with, you know, a kind of stress level here, rather than we got locked in a carrier, my stress level's now up here, then that's a brilliant place to be starting, you know. So, you know, one of the things would be, if you've got a cat that is already not okay with a cat carrier, the best thing you can do is start off with a new cat carrier. Actually, you know, context, changing the context of something gives us the opportunity to learn something new. You know, the memories a cat has got about a cat carrier will always be in their brain. We don't have, you know, I always say to people, we don't have a magic rubber that can rub away memories, unfortunately. Once a memory's made, it's there, you know, and we don't get little magic erasers. So, you know, a good thing to do is to create a new context if you want to teach them something new. So, you know, you can put that other old cat carrier away. And another top tip, I was chatting to a lady just last week about this with her cat carrier. She'd gone out, bought a very expensive pedigree kitten, actually, and she'd gone out and bought this incredibly expensive cat carrier, and it was awful. And I had to tell her, because her cat was so distressed. And, you know, and I said to her, I didn't realize how much it cost her, but I went back out and I said to her, you know, what might be a nice thing is if we might look at the type of cat carrier that you're using to bring, I call her Puddles, into the practice, because actually if she comes in already a little bit distressed, then, you know, it's making the whole thing more negative for her. And actually, I'm afraid the cat carrier that you've got, she's really not enjoying. And so what's best for cats? Certainly the best thing for cats is often a cat carrier where there is coverage, you know, so it's not open. You can get wire baskets that are just totally, the cat can see all around them. And actually cats do tend to like to hide when they're scared. You know, I've got lots and lots of data on that. But equally, they don't normally want to be in a totally black box. They want to be able to see what's going on. They want to be able to think there might be options of escape. Options for escapes are a big thing for both cats and dogs, but particularly for cats. And so actually, in my experience, the best kind of cat carriers you can use are carriers where there's a covered area, but at the front, the door is see-through. You know, and there are a variety of options of those. You know, some of them have got perspex front doors. If you go for like a wicker basket type of effect, then you can get ones that have got wire doors that, you know, are mesh or grids on the front. And they're often better, you know, because it gives the cat the option of two things. I can hide at the back, you know, or I can really look out, you know, and that can be a lot better. And if there's a time when we don't want them to look out, well, then that's quite simple. You can always bring a towel from home that smells of home that you can then use to cover the whole thing. So think about the carrier itself. Now, one of the things about that, if you go for a wicker basket kind of carrier, is that when you're trying to get the cat used to that carrier, you might be a little bit more limited. And what I mean by that is if you use some of the carriers which you know, are plastic, you can take the top off the bottom, you know, and they still have one of these mesh doors. And the reason why that can be helpful is that if you start off getting them used to the new carrier with it in pieces, that is easier for most cats. So actually the first thing I tend to do with most cats is I first of all get them used to walking across, or if they'd like to, sitting on, that's their choice, a towel, something you're going to put in the bottom of it. And you can just literally use treats, little tiny bits of fresh chicken, a little bit of fresh fish, dried fish, whatever it is that floats your cat's boat, and use tiny little bits of the food to actually put onto the towel. Just it can be on the floor, it can be on a table. You know, many cats like to be up rather than being on the ground, to be honest. So, you know, but it depends on the cat and how confident they are. And just get them used to actually the concept that they can walk over a towel by just dropping some bits of treat for them to just go pick a piece up, see the next bit, pick a piece up, etc. And then what you can do is then you can lay that same towel in the bottom of the carrier, you know, with no top on it. And then so that they can practice actually just going into the carrier with the same towel in and walking out or sitting in it, you know. And then what we can do is we can get them used to doing that underneath something. Here, dining room chairs, kitchen chairs can be really, really helpful. We just slide the bottom underneath the chair. So again, it's not immediately closed on the top for them, but there's a ceiling. And then we just get them to do the same thing, go in, have a couple of treats, come back out. You know, and then by the time we can do that, normally we do find that we can put a lower cover, and you can maybe, if you want to take it a big step, if they've been very nervous before, you can get a big cardboard box and put the cardboard box over the carrier. And the reason why that's helpful is you can take the front and the back off the box, so it's in effect a corridor, so that they can go into the carrier with the ceiling on and then walk out of the other end. Yeah, and just getting them used to that first and just practicing that at home if you want to make it very different from your previous carrier, you might want to think about smell, you know, and just think about, is there a smell in your house that maybe you think your cat might like? You know, I think we've got to be really, really careful with things like essential oils, perfumes, etc. for cats, yeah, and for dogs, of course, too. But so it might be that actually you pair it with maybe a slight spice, you know, something more natural, you know, maybe a bit of plant. Some people, of course, use catnip, which many cats like, but some cats don't like catnip at all. And we don't necessarily want to get like a chemical response to that. All we want is for them to associate the new look of the carrier with also a smell, just because it kind of gives a newer feeling to it. You know, so you might want to use something like chamomile. You might want to use something like vanilla. You know, maybe your cat might like something like fennel, just a tiny little bit of dry powder that you've got on a shelf that you mix in a little tiny bit of water, that you just smear a tiny bit of in the bottom underneath the towel, you know, very, very small. You'll probably only just about be able to detect the odor, but for the cat, that can really, you know, just give them this, oh, this smells and looks different, you know. And so by the time, you know, and what you want to do is you don't want to have it out all the time. You know, that's not what you want to do. You want to, because we don't want the cat to think this is a brilliant bed, and then when you do shut them in one day, them think, oh my gosh, beds in the house can be really awful, you know. So it's quite important that we maybe just get it out once a week. I say to people, pick a day that you know on that day of the week is the kind of day where you're relaxed, you've got time at home. You know, it might be a Sunday for some people, in some cultures it might be another day of the week, and you're always going to do it on that day. You're just going to get the cat carrier out every single Sunday, and you're going to pop it down, you're going to put in some tasty treats, the cat's going to go in, have some tasty treats, and come back out again. You know, and you might practice that just once, you might do it again 5 minutes later, and then you pop the carrier away again. If your cat can self-load themselves into a carrier, it's huge. And I know it sounds silly, doesn't it? Like that makes such a big difference, but it doesn't, you know. And then another thing that, of course, that you can do after that is once they've got confident about that, you'll want to be able to just shut the door and then just pick the carrier up and just move it 2 or 3 feet, and then open the door, give them a little treat, and let them out again. Because what you want to do is like rungs of the ladder climbing up to the top of a building. What you want to do is put lots of rungs on your ladder to climb up to them, realizing that the basket can move, but they're okay. Yeah, that's really important. And because cats, that they can get motion sickness from cars, you know, and so just getting them used to, you know, the fact that they're going to go in the car, you know, or they're going to be carried, can be beneficial. Something else to just consider about that is if you've got a cat who, you know, is really terrified of the vets, you don't think you've got time to be working on that. We do know there are medicines which can be given to cats 1 or 2 hours before they travel, which can have a huge impact on their stress levels. And the most studies that have been done with cats is a medicine called gabapentin. And gabapentin, which can be given at home, it's a little capsule, can be hidden in a tree, or if necessary, open the capsule up and put the powder into something tasty, given 1 or 2 hours before you're going to go to the vets, can make a huge difference to individual cats' stress and experience at the vets. It's a good anti-fear medicine. And more vets are using it now for cats, but still not enough. So it might be something that we have to advocate for our pet. I've heard there's this medicine called GABA something, you know, that we could use for my really scared cat. Could we give that a go? You know, and it doesn't have too many undesired effects inside the body. It doesn't really affect, say, the heart, the kidneys, the liver. Given as a one-off dose, you know, it's relatively safe to do so. Most cats don't have to necessarily even have a checkup, you know, for the vet to know that it's okay to give a cat. They are going to know need to know the cat's weight, and they are going to have to have seen the cat before to be able to prescribe that kind of medicine. But, you know, it can make a huge, huge difference. Dogs, kind of the same, really, and not the carrier bit, but in terms of medicine, because it's probably, I'm not going to talk about medicine anymore, but you know, there are medicines which we can use. Gabapentin is one of those, but there are others for dogs which can be given before the vet visit, and they really can help. You know, so if you've got animals that you know are really, really scared, then please don't be afraid to ask the vet about that or advocate for that, because it's such a big thing. You know, when we go to the doctors or to hospital, we're scared, you know, even though we know why we're going. So imagine then if, you know, somebody just came along and kind of bundled you into the back of a dark van and drove you somewhere where you couldn't see where you were going, and you got out and people started, you know, kind of touching you and pinning you down, etc. Would be awful. And, you know, and we feel like that even when we know when we're going, you know, why we're having it done. So imagine not having any understanding at all. So getting there in a stress-free way, big deal.
I think, you know, just thinking about, you know, the cat carrier and everything that you've been talking about, it makes so much sense, particularly as we're talking about cats, because to put them in something that's alien to them and then carry them, which is another alien experience, and then take into a further alien environment in which people are, they may be sounding nice, but they're not doing nice things. It's you know, you can really see cats, they have a real need to be independent, and everything's been taken away from them. They're completely helpless and powerless. It's a very difficult thing, and I hated taking them to the vet because I knew how much pain it caused them. I did so much to try to minimize the impact for them. But ultimately, if I had had the understanding, which funnily enough, it's having Teddy that's introduced me to the animal behavior side of life. And I wish I had known when I had my cats what I know now, because I would have been able to help them so much more, which is one of the reasons why we're having this conversation, is, you know, so to help people help their pets so much more. It's so with dogs generally, it's not a problem getting them into the car. It's, you know, I mean, Teddy is much easier, you know, he's much happy, he's very happy to get in the car.
It's familiar, isn't it, to them? It's
familiar.
A familiar process to most, you know, they are what we often call habituated. They're used to it. It's a fairly neutral thing. Maybe it's even a predictor of good things for them, because they tend to go in the car when they're going for a walk, you know, or to meet their buddies or whatever. You know, so, and that's important, for us to appreciate. So then it's kind of getting there, isn't it? It's now you're there. So I think one of the fascinating things for me in the pandemic, which is it really highlighted some of the stuff that we can do, is seeing the difference in my patients when I examine them in a veterinary clinic now, where basically we're still not in the UK, majority of practices still aren't allowing the owners to come into the building with their pets, and you know, that is starting to change now, you know, but it's been like that for 18 months. And during that period of time when owners haven't been able to come in with their cats or dogs, you know, my initial gut reaction was, oh, this is going to be awful, because we've got lots of research which has shown that the animals do get reassurance and they get stress reduction from having their owner, their human companion present. And so I've always advocated for dog owners, cat owners, horse owners staying with their pet during the examination process. I don't take dogs and cats out the back to do a blood test. You know, I try and actually get the owner to participate. They're not going to put the needle in, but they are actually going to, even with cats, I will get the cat sitting on the table, standing on the table if necessary, and I just get the owner to lift their chin for me. No one's restraining the cat. It's the same with the dog. No one's restraining the dog, just lift their chin. And because if the owner's doing that, again, it's familiar. It's normal for owners to be in close proximity and touching them perhaps around their face. And although maybe it's not something they've practiced much at home, a lot of people do stroke their dogs and their cat, even the cats have brands under here, don't they? So they like this, you know, with their owners. So it's sort of familiar, even if it's not exactly the same. Whereas when an unfamiliar person comes towards you, moves into your personal space, holds on to you, whoa, your stress levels have gone through the roof, you know. So one of the things that concerned me in the pandemic was, how am I going to find this for the cats and dogs that I normally see? And I've got to be honest, they've been better. They've been better without their owners. And I don't think it's the without the owner component. It might be that in some, and I'll come on to that in a minute, but I actually think the reason why they're so much better is they're not in the waiting room. That's a huge
yes.
Because when you bring your dog into the vets and you bring your cat into the vets, you will have a wait, and depends on how busy that vet's been on that particular day, and how early or not you arrived, but you're going to have to come in and you're going to sit them down in an environment that smells of fear. Remember that dogs and cats have a much more superior sense of smell than we do. So it smells of fear. They also have more pheromone responses than we do, which means they actually can pick up on adrenaline and noradrenaline and cortisol, and it causes reflex changes in their body. So when they come in and they actually detect through a part inside their nose adrenaline, noradrenaline and cortisol from other animals, they're going to start having heart rate changes, blood pressure changes already, and we don't want that, do we? That's not what we want. And of course then they start getting anxious. The cat starts wah, wah, in the carrier, and getting stressed, and the dog starts pacing and whining. And then of course what we do as owners is we go, oh, please don't do that, please don't do that, and particularly with dogs we go, just sit. And I used to find myself pre-pandemic coming out of my consulting room a lot and just saying to the owner, it's okay, he doesn't need to sit, just give him a stroke, and if you'd rather, just pop back outside and go for a sniff for 10 minutes. I'll come and find you when I'm ready. Because the dog who's sat in the waiting room, who's now stressed because of the smell and the pheromone responses of other stressed animals and stressed humans, as well as the perhaps even smell of disease, etc., and medicines, which is not pleasant for anyone, is it? Who's getting anxious, who's now being told, sit still. That just ups their stress level more. And the owner's getting stressed. And we know that as owners get stressed, our pets get more stressed. So pandemic, brilliant. Everyone stays in the car, familiar to the dog. So dog's not getting stressed. Not as familiar to the cat, but it's not as bad as coming into a waiting room where they can hear dogs, smell dogs, hear cats, smell cats. Cats are highly territorial animals. They're not the same as dogs. So moving to a new space like this, very, very threatening to them. That's why I said earlier, you can definitely pick a practice that has a separate dog and cat waiting area. That will help, because at least hopefully they can't see and smell dogs as clearly, but it's still a stressor to them. And if actually they can stay in the car, then you may find that that's even better for them. And I think that plays such a big role. The waiting room stress plays such a big role that now that we've eliminated that at the moment, certainly in the practices I work in, the dogs are nowhere near as stressed. The cats are nowhere near as stressed. It's made a huge difference. So I personally think if we could eliminate the waiting area and then you and your pets could come straight into the consulting room together, you'd be less stressed, your pet would be less stressed, we'd be in a much better place. So us offering reassurance, if you do need to go into the waiting room, if you are going into the consulting room, if you are in the car with them waiting, just talk gently and quietly, calmly. Try yourself to be aware of your own stress, deep breaths, put some favorite music on, chat along to it, do a quiz on your phone or something out loud so that they can hear your calm voice. Because our reassurance, both verbally and physically, where that's appropriate, because the cat or dog like it, is highly beneficial at bringing stress levels down. So, reassure them. And please don't think that, well, yeah, but if I reassure my dog, when they are pacing and whining, then I'm going to get more pacing and whining, aren't I? That's a total misunderstanding, which has been fed into many of us along the way. You're not reinforcing the behavior of pacing and whining. because pacing and whining is an automatic emotional response in the animal to fear. So actually what you're doing is you're reducing the fear which drives the behavior of pacing and whining. You know, my analogy for that often is I say to people, if you're in your own house of an evening and suddenly you heard bang, 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 bang and screaming at your window, would you feel better or worse if your partner said to you, I'm going out, and they just left you by yourself? Yeah. Or would you feel better or worse if they came to you and went, oh, gosh, should we deal with this together? You're going to definitely feel better when you deal with it together than if you're left by yourself. Yeah. And multiple studies in animals have shown us that, and to a degree it's something we call social buffering. The presence of a calm, familiar individual can actually significantly reduce stress in others. You know, and so this social buffering effect really applies at the vets, and we've got research that tells us that as well. Calm owners present with their pet means less stress in the pet itself. So go with them, stay with them, and whether that's in the car, in the waiting room, in the consulting room, you know, be mindful of your own responses and reassure them. And don't think that by reassuring them you're reinforcing unwanted behaviors. You're not. You're lowering the stress and fear which causes those behaviors. And you might feel it's doing nothing. The dog might still pant and whine, the cat might still be in the carrier, but I promise you, your presence, your calm presence, is helping, you know, even if it's not getting rid of the problem. Yeah.
I used to, with our cats, because of the waiting room, used to really concern me. So there were gaps, you know, the plastic carriers, you know, they had gaps in them. So we used to put paper on those so that they couldn't see if there were any dogs in the waiting room. And we used to face the carrier to us so that they had a limited view. If there were any dogs, obviously they'd be able to hear them or smell them. But it did help, I think. And the other thing I used to do is I used to tell them stories. I used to sit there telling them stories on the way to the vet, and all the time and I'd make up silly stories about things that they'd done in their lives and just talk to them. That's what I used to do for the cats. Teddy, as a puppy, we didn't have an issue with the waiting room. He just thought it was great fun, you know, coming in and meeting everybody. But as he got older, he started to become reactive to certain breeds, like Rottweilers, the big one for him. And because we can't predict what dog is going to be coming into the waiting room, we wait in the car. And that's, I think, really good, because it means that he tends to be fine in the waiting room. And because he sits on my lap, he's happy on my lap, he's looking around, and he's had positive experiences with the staff. So on the whole, he's fine, unless some big dog comes in. So I realized that I am the one who's anxious, because if a dog he doesn't like comes in, then he gets absolutely stroppy and aggressive, and I have no idea how the other dog's going to react. So this is an issue. And I find it much better if we're in the car, I'm happy and relaxed, he's happy and relaxed. The staff, you know, come and get us when they're ready, and then everything is good. So I really get what you're talking about with the waiting room. I think that would be a big thing. Now, how are you finding, because talk about avoiding going to the vet, thank goodness we haven't needed to do this in the last 18 months, because Teddy has separation anxiety, as in he doesn't deal well with being separated from me. Although he's had to have procedures in the past where he's taken out of the consulting room when we're together. Actually, because of that, I found reluctance starting to build to going, because his thing is, if I go there, you're going to leave me there. Well, these things are happening to me.
Mm-hmm.
And we've had to work on rebuilding his confidence. So how are you handling this issue now, where people haven't been allowed to go in?
Well, do you know, it's really interesting. I personally, I don't think in the majority of dogs, cats, you know, it's always going to be they don't know, most cats, not all, but most cats don't have the same intensity of relationship with their owner, that it's as big a problem for the majority of cats, actually. Although that doesn't mean to say that cats don't bond with owners and don't get separation related problems. We recognize actually that happens way more than we think. But interestingly, I don't see that many dogs and cats who have such an issue about coming away from the owners and being away from the owners at the time of the examination or a procedure. It is more that it's the way that we handle those animals during the separation that's the bigger issue for them. You know, so like you said it yourself, you know, when they're taken away from us, then it's because we are going to do something that's with a greater intensity than we would normally do in the presence of an owner, such as we're going to restrain them and raise a vein and put a cannula into their vein, or we're going to give them needles, you know, or something along those lines, basically. And, you know, the thing is, the intensity of those experiences is often so great that it totally, what we call, overshadows the fact that they're actually away from their owner. You know, so their brain, their threat detecting center, is paying so much attention to the fact that they're being restrained, or that they can feel something painful happening, that, or perhaps they're now in a cage out the back where they can see other unfamiliar animals, that is such a big thing for their threat detecting center to pay attention to. The fact that you're not there isn't what the animal's associating it with. So absolutely, it might appear that they don't want to go to the vets and move away from you, but it's not the loss of us that's the big thing. It's the fact that coming away from you is the predictor of something awful happening. And so what we need to do more in practice is we've got to get better at making sure that we minimize how awful those things are. And this is part of that vet discussion. For example, if we're going to do a blood sample, or we're going to put a cannula into a vein away from an owner, why didn't we put local anesthetic cream onto that area to numb the skin when they were in the presence of the owner, and let them be with their owner for as long as possible before we take them to go and do that procedure? Because we've got very good evidence that shows a minimum of 20 to 30 minutes, it does take at least that long, these local anesthetic creams really genuinely, again, reduce the response of the animals, the pain response, and therefore the stress response to having stuff like that done. So, you know, if as vet handlers we're more mindful, you know, the handlers at the vets, we're more mindful about the way we're dealing with the animal, then we don't get the same kind of, you know, separation concern. You can, of course, send something with your pet that is familiar to them. You know, my dog had to stay recently, one of our dogs had to stay in a practice because she had to have major surgery on a leg, and she had to stay, and I wasn't going to be there for that day. And I sent her in with her favorite teddy bear. And I'll be honest, they all looked at me, I know the staff well, and they all looked at me like, does your dog really need that? Because they all perceive her to be pretty relaxed about it. You know, she has grown up with a vet, and she's kind of grown up in veterinary practices, you know, so she's used to the smells and the sounds, etc. And she's used to going in and out of practices from time to time. But, you know, still for me, I know it's going to be a stress for her to be away from us, to be away from her canine companions, to have everything done to her that's going to be done to her. So I sent her in with her favorite teddy bear. And I don't know if it made a big difference, but at least it was something I could do. You know, so sending them in with something that's familiar to them, that they get comfort from, could be a blanket, could be a toy, could be your cat's favorite cushion, you know, as an example, or at least a favorite cushion. And perhaps if that thing isn't something that's very smelly of us, our smell as well. Now, really interesting research that's been done on dogs has shown us that dogs' sense of smell is so good that what clothing we are wearing and what we did in that clothing actually affects their heart rate. So if you gave and I've got an example here. This is a friend's t-shirt that they lent me for my dog after her surgery, when I was collecting what I call a nose library, different smells, different family friends, different animal friends as well, and their toys, so that my dog could interact with those objects on a daily basis while she was on strict post-operative rest. And so my sister-in-law actually gave me this t-shirt, and it didn't bother me particularly because of that particular exercise, but this is something, I'm sure she won't mind me saying, this is a t-shirt that she wears to muck out her horses. So she will have got sweaty, lovely, in this t-shirt, and she deliberately gave it to me for that reason, because she knows that it will have a kind of fairly unique odor. That's not the t-shirt to send your dog into a vet's with, because what we know is that if you've done exercise, hard exercise, got sweaty in a t-shirt, you've produced adrenaline and noradrenaline that's impregnated itself into this lovely t-shirt, and that might actually cause an increased heart rate and response in your dog. So this work that was done by a team led by Siniscalchi showed that if we give dogs a t-shirt that their owner exercised in, their heart rates went up, because they're detecting that adrenaline and noradrenaline. So when you send your pet into the vet and they might be staying without you, take in your bed socks, take in the t-shirt or pajama top that you sleep in, because your sleep chemistry, a time when you're calm, is total opposite chemistry to this. You know, so it's being mindful of those kind of things, really. So sending in something that has your calm, you know, perhaps your yoga t-shirt, you know, if you do yoga or Pilates and that's a calm thing for you. But for most of us, it's probably going to be something we've slept in. Has a much better potential for calmness for our pets than the sweaty socks that you wore to the gym yesterday. So something that they find comfortable, and an item of clothing that's calm for your calm odors, can be hugely beneficial, even if you don't think it might be.
You know, it's so obvious when you say it. It's so obvious. You know, when you were talking about the exercise, I thought adrenaline. Of course, the last thing you want is for them to be smelling adrenaline.
More adrenaline, yeah.
It's so obvious, and yet, you know, most of us would not think of that until it's made clear to us. I was just thinking about what you were saying about the way they're handled and the separation aspect of it. Yes, of course, you know, what's happening to them is going to be the thing that's immediately on their minds. But I had two occasions when I heard what Teddy thought of what was happening to him. The first was where he had to have a little procedure. He was about 11 months old, and it wasn't, you know, being neutered, but it was a small procedure. And as I walked out, I heard him, you know, that bark they do when they're going, help. I really don't like this. I'm hard. I will remember that distress call the rest of my life. And I thought, oh my goodness. And I'm sure at that point, nothing had happened apart from me leaving. That's the point at which I left.
Yeah.
But the second one, I think, was even more telling, because I was in the waiting room and he was at the back, and he was waiting for his turn to have blood taken for blood tests. And I could hear him sound when he was sounding distressed. And our vet was lovely. And I said to her, you know, he sounded really upset. She said, well, he was upset when he wasn't getting attention. Whenever he called out, if I turned and spoke to him, he calmed right down. But it was when I was busy doing other things. And I thought, well, of course, I'm not there. He likes her. He's looking at her for reassurance. And so when she talks to him, he's reassured. It turns her attention to whatever she's doing, because she's busy.
She's got to do her job,
Got to do her job. Then he's automatically frightened again. So it was such an interesting experience when she,
and we see it every day, and it's built in clinical practice, and it's very, very tricky for the staff, because we know it. A dog is barking, in their cage, having woken up from their anesthetic. They've been checked, they've had some reassurance, we know they're okay. We've got to move on to another patient, we've got to do our job. But as we move away, they realize they're by themselves. They've lost that social buffering effect. And then, of course, but if we go back, and the problem is in veterinary practice, people perceive that what they're doing is reinforcing the dog's bark, because what they perceive is, if I give the dog attention when they're barking, then they bark more. Well, yeah, they bark when you take your attention away because they don't want to be by themselves. You're not reinforcing them for barking. What you're doing is providing a platform for the fact that, that they just have to give up trying, many of them, because nobody ever comes. If they bark and bark and bark and bark, most dogs will eventually shut up. Most cats will stop eventually yowling, because it's just the brain goes, well, this strategy is not working. Best thing is to stop expending that energy. Now, not all dogs give up. Some will go on all day, but the majority will give it up. And of course, understandably, veterinary staff often think, oh, well, then it's better not to provide it at all, so that the dog shuts up. Because every time we give them some attention and they stop, and then we walk away, it just starts up again. It's a very tricky balance, and I don't think it's one that we can resolve realistically, which is why I personally work very much on the premise that we get them in for the shortest possible time going. So another kind of top tip that I have when we think about our role as the human caregiver for our pet in practice is chat with the practice about why you're leaving them there and how long it's going to take. And can you make sure that you are available to pick your dog up or cat up on that day as quickly as possible? Because sadly, one of the things that we do come across a lot, and I know it's out of control of a number of caregivers for sure, but is that we know that the animal's now woken up and we know they're fine and they could go home, but there's no caregiver to come and collect them. And now that animal might have to wait 2 hours, 4 hours, 6 hours before they're collected. We don't need that to happen. In the majority of cases, you could get a friend, a relative, you could ask your boss to shift your hours that day. There's lots and lots of ways that we could make ourselves available to pick that animal up at any time, as soon as the practice thinks that they're ready to come home. Let's not just think that we drop them off at 8 and we pick them up at 6. Because actually for me, I get a lot of owners to maybe bring them in at 11, because I know there's only one operation that's going to happen before that time. So bring them in at 11. As long as you promise me they're not going to have eaten in the last 3 hours, if they're having an anesthetic, they can come in at 11. That's fine. If you can pick them up at 2, brilliant. So as another top tip really is just to think about, are you going to be able to make yourself available to collect your animal to get that reunion as quickly as possible, because it's the best thing you can do for them realistically. I used to for a little while I did some education in the Czech Republic, and one of the lovely vets that I did that with, Martina, she had a practice where any operation that she ever did, the animal arrived for their operation, they stayed with their owner while she gave them any pre-medication. They then stayed with the owner while the pre-medication took effect. And then basically they are only separated from their owner at the point of inducing the anesthetic. And the owner stayed either on the premises or nearby, so that as soon as the animal was recovering from the anesthetic, they could stay in the clinic with their pet, and while they were recovering, and then take them away as soon as the practice felt that it was okay for them to leave the building. Now it is tricky with the way we are busy wise, and particularly at the moment in the United Kingdom and in some other countries, because there's been a surge of pet ownership during the pandemic. Practices are phenomenally busy, and we don't necessarily have the time to kind of give over to that level of individual procedure, even if we would love to. But we can still do more, if we make sure that we're totally available on the day they're coming in, so we can drop them off as late as possible and pick them up as early as possible, and leave them with something that comforts them and some nice, calm, smelly stuff of ours is phenomenally better. Huge, huge, big difference that can make.
I do believe, I seem to have this vague memory of Teddy going in with a teddy bear, possibly for when he was being neutered, because I'd got wise to this by that point. I have this vague memory that he went in with his teddy bear, and you know, the staff smiling at me rather.
Like me when I drop my dog off, yeah. Yeah. Yeah.
But yes.
And bear in mind that actually when we do things like that, you know, it might be an idea not to necessarily take their most favorite toy, because there is a possibility of associations. You know, they might now associate that toy with more stress or more fear, potentially. It's probably not that likely to happen, because you've got to think what the brain is really looking for in terms of what are strong predictors for potential threat. But it is a possibility. And you know, if we were to then go home with their teddy bear and we could see that the dog doesn't interact with that toy now, we didn't want that to have been their absolute favorite. And the other thing is we might want to wash it afterwards, you know, once they've come home the next day, just to remove some of the odor of having been in the practice, you know, etc. So that's one of the reasons why, you know, using the favorites, you know, your cat's absolute favorite cushion that they always sleep on, you want that at home ready for their recovery. So what you want in preparation really is somewhere else that you know that they like to sit on, and another cushion that they use sometimes that they like and it's familiar, but it's not their favorite. Because when they're home and they're recovering from an anesthetic or the stress of what's happened to them that day, you want your favorite, you know, and you know that should be there in situ as it's always been.
That's just wonderful. And I am so grateful that you've taken the time to talk to us today, because I think that everything, all the advice that you've given is something that people can really take away and do something with. It's very, you know, most of us, it's such a wrench for us to take our pets to the vet, and then at the same, and even worse, having to leave them there is I'm sure I'm not the only one who's heard the strangled distress cry of our dog. So it's so I think this is, at least it also gives us something to focus on and something to do that's positive and that we know is going to be helpful. And I think one of the most important things that you've said to us today is, no, it's wrong to think that you're reinforcing by giving reassurance, because to me, that's always been obvious that you give reassurance. And it always seemed like the wrong advice to give. It's the same thing, you know, when they come in as puppies and they're told to just, you know, just leave them where they're going to sleep and let them cry it out. And I think, really? No, that's not what you do. It just, I always knew that instinctively. And to hear you say that today, I think is going to be very reassuring to many, many people.
It's a funny thing, you know, when I used to have this discussion, particularly with a lot of drugs companies, you know, when we get to fireworks season, you know, always see these displays, which is about now, certainly in the United Kingdom, as we head in towards sort of, you know, into November. And obviously different countries, it will be at different times of the year, you know, America, etc. But as we head towards those periods, you'll often see posters going up in veterinary practices, you know, and they always like wind back 10, 15 years. I've been in practice 22 years. They always used to say on the poster, don't reinforce their fear, ignore your dog. And I used to say to the drugs company, please, can we take that off the poster? And do you know what? Over the last 5-8 years or so, it's pretty much come off all the posters, because we all mostly in behavioral science have got our head around the idea that you're not reinforcing a behavior, you're actually modifying the motivating emotion that created that behavior. And you'll find, you know, all the, you know, the true experts, veterinary behaviorists, clinical behaviorists, good quality trainers, you know, all saying that's not just new from me, but it's taken a long time for us to really filter that through. So don't feel bad if you've not heard that before and you're still thinking about it, because it's taken a long time for that to filter through effectively, but it is the truth. And social buffering is receiving more and more scientific attention. This effect of being reassured by a familiar individual in the presence of the stressor is now well known to reduce the stress response in that individual. So whether that stress is caused by fear, whether the stress is caused by pain, whether the stress is being caused by frustration or some other, underlying emotional state, doesn't matter. Social reassurance will reduce that. And I think it's great to see that that's changed in veterinary practice, but it's still not necessarily talked about by every vet, every veterinary nurse, every veterinary staff, because there's so much to have learned about the medicines and the diseases as well, that kind of keeping up to date with everything becomes almost impossible. And sometimes some practices are more kind of behaviorally biased than others. And that's what I said, if you're not hearing the right phrases from your current practice, let them know. And be happy that you're the advocate for your pet, and that doesn't mean to say just ditch that practice. Talk to them about it first, because maybe some of them just don't realize, and they're actually quite willing to learn more once they realize that you're not okay with it, and I think that's just the important thing, isn't it, that we are advocating, we are the voice for our pets, and therefore what you feel about your pet is totally valid. Don't lose that in the face of a professional. It's not about disrespecting the professional, for their opinion, but you are there, to advocate for your pet's well-being on the kind of emotional comfort perspective, and that is something that we can easily do with lots of these sorts of ideas.
I think, that's just so valuable. I always felt that although I didn't at the time have the understanding that I have now, because it's been a learning curve with Teddy, I always knew it was that gut instinct, that says, well, this doesn't make any sense to me. And I know that I'm being told this is what you do, but no, that's not what I'm going to do, because it feels wrong. It just felt wrong to abandon him when he was distressed. And so we took a very gradual approach. And then as I did that, I realized, well, actually, I'm doing the right thing. I'm taking a very gradual approach, to getting him to sleep on his own. I'm not just abandoning him when he's distressed. And that was so I'm always very happy when I hear that reinforcement that, yeah, this is what you do. This is right. So to hear that, because the first person I ever heard say that in the context of the veterinary practice was you. And it was when I did the workshop, that wonderful workshop with you a few years ago. And I thought, yes, this feels right. And so I want to thank you again for your time today. And if people want to access your wonderful articles, how do they do that, and your website?
I don't currently run a website. I do have a Facebook page, a business page, which you can just view. It's open access. My business is called Understandanimals, and you'll find me on Facebook, I would hope, Understand Animals, and that's the best place to go, and to find out. I try and post at least 2 or 3 times a week, different bits and pieces. Sometimes it's quite geeky science, and sometimes it's just totally practical, non-geeky at all. I try and mix it up, because I get quite a different following. People who want like really hardcore science, and then people who I don't want the science at all. So I try my best to mix it up as best we can. And but anyone would be welcome to come and have a look at posts on there. Thank you.
I love your articles. I share them a lot, and I like geeky ones because I don't always understand them, because the language is sometimes quite technical, but I can skim through and get the gist. So I can skim through the gist, and that's good. And then I also, of course, love the other ones, which tend to be the ones that I share most, because they're so insightful and full of understanding, which is what Pet Talk is about, is widening understanding. So thank you once again for joining us today. And I do hope you'll come back, because there's so much I want to talk to you about.
I would love to. Thank you so much for inviting me, and I hope people find it useful. And good luck with the channel.
Thank you. And next week, well, I think we are going to be talking about horses. That's the plan. We're going to be talking about horses. So until then, thank you for joining. Do please subscribe so that you can see all the lovely interviews that we've had so far. And goodbye.